Hello everyone, this is Pallavi Priya Nehru and today we are going to talk about radiology, which is a part of CPT, current procedural terminologies, and the code series are from 77. Now radiology, as we know, is the branch of medicine which deals with the radiations like nuclides, radionucleotides or NMR, ionizing radiations or MRIs, X-rays, CTs, for what? To diagnose and treat diseases so that the actual difficulties and actual problems can come into focus. So that's about radiology. Now, one of the most important guidelines when we talk about radiology is the anatomical position. Anatomical position means the position in which the human body is placed when you are taking any kind of X-ray or MRI or CT. Say for example, oblique, anterior posterior, posterior anterior, okay, lateral position, prone position, supine position. So these are the positions which are very important, keeping in mind which anatomic area is being affected by any kind of disease or fracture. Okay. Now there are different types of contrast materials which are used in radiology. Now contrast materials, those are drugs, or you can say they are kind of materials or medicines which are injected or administered in the human body so that they can highlight the area which is being studied. Okay. Now this contrast material is administered in three ways. The first one is intrathecal, then you have intra-articular, and then you have intravascular. So these three methods you can administer the contrast materials easily. For example, you have gadolinium, you have iodine, which is a very hypoallergenic contrast material, mostly used in IVPs, okay, or MRIs. So this is what a contrast material is all about. Then you have different types of radiological services which you might study in CPT section. They would be diagnostic radiology, ultrasound, then you have radiation oncology. Next you have breast and mammography, nuclear medicine, okay, and then bone and joint studies. So these are some of the overall topics which you are studying in CPT radiology section. One by one I'll just brief you what exactly they deal with. So mostly they deal with MRIs, X-rays, okay, DSA, then you have MSA also included in that. Then when we talk about the films, there are different types of films also. Films are those black colored screens where you can get the exact X-ray, different kinds of pictures, okay. In the films you can see that. Then the other part would be the different types of ultrasounds. Nowadays ultrasounds are in 4D and 5D also. They are generating pictures and plates in that. So you have A mode, you have B mode, you have M mode ultrasounds, then you have real-time scans also in that. Now apart from that, when we talk about bone and joint studies, so you have bone length study, you have bone joint studies, you have osseous surveys, you have DEXA scan also, DEXA, okay, which is mostly to detect the bone density in the human body. Then you have breast and mammography, so that if a patient is suffering with any kind of breast cancer or the onset of the breast cancer, it can be screened positively or negatively accordingly. The last would be in the discussion is the radiation oncology and the different aspects of PET and SPECT scans, okay, which you have to study in detail. Now, one more important thing in this chapter is the use of modifier 26 and TC. Okay, that is a very important modifier which is frequently used in this chapter along with other CPT radiology codes. So this is an overall view of radiology and what we study in CPT along with the views. Okay, views means there are different types of views if a structure is being studied. One view, two views, three views. Say for example, there is a fracture in the knee. So the doctor would advise different types of views of that particular affected structure, and that has to be coded accordingly, and you'll get the required codes in the chapter itself. Okay, so these are certain points which you have to remember. Say for example fluoroscopy, then you have ultrasonic guidelines. So these are based on the type of procedure which is performed, say any vascular access or pericardiocentesis. Okay, so every procedure is code specific. So you have to select the codes accordingly. So this was about radiology CPT. Thank you so much.